Hi, I'm Jamie Roddy, a typical college co-ed who tries to enjoy life and the college experience. But if I'm not careful, there are scores of diseases and illnesses that could affect my life and ultimately my happiness. I want to share with you information concerning a widely spread sexually transmitted infection called human cytomegalovirus, or HCMV. First of all, what in the world is HCMV? Human cytomegalovirus is a virus of the herpes families and comes from the Greek word cyto, which means cell, and megalo, which means large. And the virus that affects humans is known as the human herpes virus 5, or HHV5. It is a persistent, latent white blood cell infection which causes mild or no symptoms in mostly healthy people, but can do permanent damage or death to an infected fetus, a transplant patient, or a person with HIV or AIDS. Scientists first discovered evidence of this virus in 1904, and in 1920 the term cytomegalovirus was used to refer to it. Later, in 1956, the virus was first isolated in tissue culture, and in 1960 it was designated as cytomegalovirus. The mode of transmission for HCMV from person to person is extremely unknown, but is presumed to occur through bodily fluids such as blood, saliva, sexual fluids, solid organ transplants, bone marrow transplants, pregnant mothers to their fetus, and through breast milk. Oftentimes, in healthy persons, it is asymptomatic or without symptoms, or sometimes may present as a mononucleus-like infection. A diagnosis can be made by testing for viral culture, which would indicate HCMV antigens and HCMV DNA. However, for transplant patients or persons with suppressed immune systems, like persons with HIV or AIDS, the symptoms can include blurred vision, blindness, severe diarrhea, cough, and stomach problems. Well, you might ask yourself, how widespread is this virus? Is there a treatment? What can I do to prevent getting this virus? Unfortunately, 50 to 100% of adults around the world demonstrate anti-HCMV antibodies, which mean they have been exposed to the virus at some point in their lives. The greater concern lies with women in the United States who are pregnant or who may become pregnant. According to the Center for Disease Control, or CDC, 30 to 50% of women have never been infected with HCMV. About 1 to 4 of every 100 women who have never been infected with HCMV will have a primary HCMV infection during pregnancy. About 33 out of every 100 women who become infected with HCMV will pass the infection to their infant. It is known that approximately 50 to 80% of women have been infected with HCMV by the age of 40. And if women is infected before becoming pregnant, the risk of passing the virus to her fetus is only 1 in 100. Currently, there are 2 treatments: Cytovine for patients with suppressed immune systems and who have site-related or life-threatening illnesses, and Valcyte, an oral antiviral that has proven effective. While there is no available vaccine for preventing HCMV, there was a phase 2 study of a CMV vaccine in 2009, which indicated an effective rate of 50%. Have I scared you enough? I sure hope not. On the bright side, most people with HCMV were infected during their younger years and have no symptoms at all. The use of condoms is normally sufficient protection against the transmission of this disease, and statistics show that the virus is not very common anymore. But I caution my fellow collegians, rare does not mean gone. Practice good hygiene and be responsible.